This is an NBC News special report. Here's Kate Snow.
Good afternoon. We're coming on the air with information about the president and his health. The president putting out a tweet on Twitter just a moment ago saying that he will be discharged from the hospital. He tweeted, "I will be leaving the great Walter Reed Medical Center today at 6:30 p.m. Eastern Time, feeling really good. Don't be afraid of COVID," the president writes. "Don't let it dominate your life. We have developed under the Trump administration some really great drugs and knowledge. I feel better than I did 20 years ago." This comes as we expect a medical briefing from the president's doctors anytime now. About 10 to 15 minutes from now is what they've told us for our guidance. Let me go to Peter Alexander, who is on site at Walter Reed Medical Center. Peter, we had heard that perhaps the president would be discharged today. Now it appears from his tweet that he will be.
Yeah, that's exactly right. And what's notable is that this announcement came from, I guess, what you would call the patient-in-chief and not from his doctors. The announcement coming from the president by Twitter even before his doctors had an opportunity to brief reporters on the state of his condition. And of course, there's been a lot of contradictions and confusion about his health over the course of the last 24 to 48 hours. So when he departs this evening at 6:30, his total stay at Walter Reed will have been less than a total of 3 days. But in conversations I've had with those close to the president, they say that he has communicated that he is, quote, ready to get out of there. The president has been itching to depart for at least the last couple of days. He says he's been feeling well, but one of the questions has fundamentally been exactly how well he is, given the fact that among those drugs that he's taking right now, a steroid called dexamethasone. That is a steroid that's typically given to severely ill coronavirus patients. Behind us right here, you can see a crowd has gathered, more than 50 Trump supporters, many of them yelling and screaming as cars pass by, honking in support, trying to demonstrate their support for the president. The president yesterday had been pushing to go home, but settled for that little impromptu drive-by that we saw. Today it appears that he will be departing for good from Walter Reed. The question now remains, if there's a setback, will he be forced to return? I'm told it's been communicated to the president that the bad optics of a setback would be particularly bad for him now less than a month from the election. Kate?
Peter, stand by if you will. I want to also go to our chief White House correspondent, Hallie Jackson, who is over at the White House. Hallie, Peter mentioned that drive-by last night. There's been a lot of criticism of that. Yeah. But tell us what's happening at the White House now in anticipation of the president returning. Where will he be within the White House complex?
Presumably in the residence, Kate. Remember, this is a president who has an active, contagious, infectious virus as we speak. And so CDC guidelines indicate that anybody who is tested positive for COVID needs to isolate. If you have symptoms, it means you've got to isolate for at least 10 days and then be 24 hours fever-free. So presumably the president will be isolating at the residence. That is where he had been prior to departing for the hospital early Friday morning, when we know that he was getting sicker faster, according to what his doctors were saying, spiking that fever and having that rapid drop in blood oxygen levels. The First Lady has been at the residence. You mentioned the drive-by, Kate. Interestingly, she had not planned to visit her husband at the hospital, according to her office and sources close to her, because she didn't want to put people at risk by getting into a car and driving to Walter Reed. So presumably the president will be here at the residence, and he will be isolating for a period of time. One of the things that I'm interested in finding out from Dr. Sean Conley in just a couple of minutes, the president's physician, is will they follow those CDC guidelines and have the president isolate for that full 10 days? He is a patient, but he is also, Kate, impatient. He wants to be out and about. This is, what, less than a month to the election. For months, I've heard from sources that this is a president who wants to get on the road and see people. Obviously, his diagnosis makes that absolutely impossible in any kind of responsible or safe way. But, Kate, when you ask what it's like at the White House, I got to tell you, it's really quiet. That's not just because the president is not here. It's also because we now have additional White House staffers who have tested positive for COVID. That includes White House Press Secretary Kayleigh McEnany. We learned today that she has tested positive after a series of negative tests. And that's really critical here because, as our medical experts keep saying, those tests are just a snapshot in time, right? That test tells you how you're doing at that moment. The virus can still develop, the viral load, and mean you can test positive later on. It appears that happens happened with McEnany. 2 of her deputies, 2 other White House staffers here have also tested positive, we've learned just in the last few hours. So you can imagine it's pretty dark in there, Kate, at least for the areas that reporters are able to access. Most staffers are working from home. They are not coming in. Some are. And when asked why they're not home quarantining, the argument is, well, they are classified as essential workers. So the things that they can't do at home and need to come into the office to do, that is what they are doing here. But it is certainly an extraordinary situation, Kate, that you have the president now returning to the White House. We also know, and we should be clear here, he is getting treatments, right? You talked about the therapeutics that he's on. Peter referenced some of the drugs he's getting. One of them, remdesivir, is an IV administered drug. Now, the White House does have a full medical unit. That is what officials keep talking about, that the president will still have a very high standard level of care here at the White House. It's not like if you or I to go back home out of the hospital, right? And it's just me and you hanging out with our families. The president will have a team of people here in order to help him through what is still days potentially of recovery left to go. That said, there was a reason he was moved to the hospital in the first place, and one of the questions here is about the credibility of information that we have been getting about the president's condition. The president's doctor just this weekend had to essentially acknowledge that he painted a rosier picture initially about the president's health than was actually the case. Conley was pressed on that yesterday, and it's possible, Kate, as we take a look at the microphone where he is about to come out and speak, that may happen again today. A lot of questions still to be answered, including about the president's condition, Kate.
Thank you, Hallie. Let me have you stand by also. Let me go to our senior medical correspondent, Dr. John Torres, because a lot to talk about here. Dr. John, pick up where Hallie left off. There is a suite inside the White House with medical personnel. It is possible to have, treatments happen there. However, I know you've said this is unusual, even for a VIP patient, to go home when still taking remdesivir, for example.
Exactly, Kate. It's unusual for them to go home when taking these medicines. Plus, if you remember, 7 to 10 days, that's the time period after symptoms start when we look at the patient, because that's the most critical time period for when they could start having symptoms worsen, they could start getting in critical issues. That 7 to 10 day time period is going to start later on in this week, and what you don't want to have is have them outside the hospital environment, and then you have to try and get them back inside the hospital environment. And it's possible patients have had this happen with COVID-19, where they go from doing okay to not doing so well to all of a sudden needing to be on a ventilator in a very quick, short period of time. But the other thing you have to remember is the White House is not your house or my house. If we were sent home, we'd pretty much be on our own. We'd have to have family help us to take care of us. But at the White House, he's going to have a full staff. He's going to have full medical contingent. My guess is that there are going to be doctors sleeping on cots at the White House, trying to make sure that he stays okay, watching him 24/7, constant monitoring. But that having been said, if they do have to do something at the White House, as in intubate him, put him on a ventilator, and then get him to Walter Reed, that is a difficult thing to do in any circumstance and not something you really want to have to do. And so him being at the hospital full time period, get through that 10-day period, is extremely, extremely important. Another one, they keep bringing up isolation. Can he isolate at the White House? Because he still has to do that for at least 10 days after symptoms start. We're only 3 or 4 days into this, so he still has a long ways to go in that context. So again, even though he has the care there are some things we need to be very concerned about.
Let me quickly, thank you, Dr. John. Let me quickly go to NBC News medical contributor Dr. Kavita Patel, who's also with us. And I know you've been talking a lot today about dexamethasone, which is the drug we just learned about yesterday that the president has been taking, a steroid. You've talked about side effects of that. What does that look like moving forward?
Yeah, critical here is that dexamethasone, a commonly used steroid, but not in the doses that we're seeing, has been studied. But again, in people who are either oxygen dependent or require ventilation or at a further illness in their COVID-19 disease than what we've heard from the president's doctors to date, side effects are incredibly numerous, with some of the most concerning ones being a spike in blood sugars that can mimic diabetes, depression, psychoses, and really just all around a suppression of other parts of the body's normal functions. It is not a drug to be used lightly, and it is something that, again, to Dr. Torres's point, is, along with other drugs the president is on, requires close monitoring. I've worked in the White House, and I've seen what the capacity is for the White House medical unit. They can do a great number of things, but it is not a substitute for intensive care unit level of care or hospital level of care.
Okay, thank you so much for that perspective. I want to go back to Hallie Jackson, if I can, just before we go away for a bit here, Hallie. Talk to me about the optics of this and the politics of all of this, because we are so close to an election. The president clearly yesterday wanted to show himself, wanted to be on video, and then went on in that motorcade to greet people through a window. What are the optics today about returning home at this point?
Well, it's a message from the president, Kate, that he is still in charge, in command, and able to lead the American people. That is the message that he and the White House want to send. And in fact, it's a message they've been trying to send even from that very first moment Friday, 72 hours or so ago, when the president first stepped onto that helicopter from the White House to go to Walter Reed. There was a reason why cameras had been positioned to be able to see the president walking under his own steam onto the helicopter to be able to go to the hospital. That is what we are seeing now to another degree, right? The president's drive-by, the video that we've been showing, that was another example of that. He wanted to get out and talk to his supporters. He also, I think, Kate, wanted to get in front of the cameras. He tweeted even just today that he felt like, hey, if he didn't do that, the media would say it was rude, and if he did, the media would complain. So he felt like he was in a no-win situation here. The bottom line, this is a president who wants to be out and be seen by people. That is something that has been consistent over the last, frankly, 4 years that I've been covering him. So it should not be surprising that even hospitalized, even dealing with this infection and with this virus, he would still want to do the same thing. I will say, Kate, when you look at sort of the optics at play here, the thing that we'll be watching for is, and there are a lot of people around this country, I think everybody hoping that the president does get well and get well soon. If something were to happen, as Dr. Torres is talking about, that sometimes with these infections, something can sneak up maybe on day 5, 6, 7, and the president were to have to return to the hospital, that would be, I think, significant, and the White House would have to be able to answer questions at that point about why they moved him out of that setting just to take him back. Now, that's getting ahead of ourselves here. The hope is that the president will be able to remain here at the White House, Kate.
Right. And his supporters certainly hoping for that. There's even been talk about him attending the next presidential debate, which is a week from Thursday. Again, the headline today, the president saying that he will be leaving the hospital at 6:30 this evening. We will return to Walter Reed Medical Center for a planned briefing just as soon as it starts. This has been a special report. I'm Kate Snow.
We now join our regularly scheduled program already in progress.
What's been going on?
It's been